At Full Circle Systems, we know that it is our duty, obligation, and responsibility to do our very best to keep you and your people safe. At FCS, we understand that healthcare is very underserved in the safety and security industry. Healthcare has many variables that require specific approaches and understanding from the industry. Probably the biggest news in healthcare right now is the CMS final ruling concerning emergency preparedness and regulation. Centers for Medicare and Medicaid Services final rule has covered a lot of material that has not ever been touched in healthcare before, and many providers and hospitals don't even know what encompasses the rule. This ruling incorporates 17 different provider types, not just major hospitals anymore. And there are 4 major elements to the rule that we need to prepare and train for from this point. The first part is risk assessment and emergency planning. This covers major disasters in your area, from terrorist attack to natural disaster, all the way down to active shooter and code gray, or active combatant in persons and situations. Second part of the plan is a communication plan. This is inter-office and from within your systems all the way to how you communicate with first responders. Third part of the plan is policies and procedures. What are your policies and procedures? Are they compliant with the ruling, and do you have any in place? FCS can help you develop those plans and procedures and implement them with your people. And the final part of the rule that they will be testing and grading for are training and testing of your facilities and your personnel, and how this corresponds to patient health and security all through the process. Code Gray. Code Gray called overhead is the last thing you want to hear, but it is what you hear all too often. Combative people in assaultive situations affect healthcare greatly. This is the #1 event that healthcare groups and staff face on a day-to-day basis. This affects staff morale and performance, as well as patients' loyalty and trust. We at FCS focus our training on awareness first, perceiving the threat before it becomes a threat. We then focus on de-escalation techniques, the verbal, body language, and response skills to calm the situation. At the end of it, we also teach defensive tactics. This is the last step that you want anybody to take, but the protection of your staff and patients is of foremost concern. At FCS, we try to serve you as best as possible in these difficult and changing situations. The worst event that anyone could face is an active shooter, active killer event. This is training for the absolute unimaginable. At Full Circle Systems, we focus first on indicators, trying to recognize behavior and situational indicators before something even happens or takes place. Healthcare requires specific responses. When you bring in assets from the outside into a healthcare situation, they have to have a prior understanding of patient requirements as well as staff understanding and reactions. We also focus on simple, fast, and effective responses for specific areas of care from single facility or multi-site systems within healthcare. Ransomware and cyber threats and security have taken healthcare by storm in the last year. FCS helps to develop a proactive training plan to combat and deter instead of reacting in concession. We also focus our training on employee operational security, both at work and away from work, as both can affect your system. We also talk about the alternative and growing threats such as USB drive malware campaigns that are prolific in the healthcare situation that most people don't even recognize. We also look at the new and growing threat of equipment and infrastructure hacking, both targeted and incidental, and the catastrophic effects that they can have on your staff as well as your patients. At Full Circle Systems, we completely understand that there is no one-size-fits-all solution. Our partners and trainers all look to engage your complete organization and our process to build effective results for you. From your executive leadership team, to management, to your security team, to your line staff, all are included within our processes and training. To fully prepare you and your staff for whatever may come, we also engage your local law enforcement and first responders in developing two things: your communications plan as well as an incident response plan. This involves you with your local resources that you will be encountering if any situation happens on your site. At FCS, we offer you a total solution from assessments of both physical infrastructure to current training plans. We also look at policy and procedure planning, development, implementation, and regular training. Our depth of knowledge and experience from our years of serving as law enforcement, military, and healthcare providers has given us a unique and highly developed ability to train and protect those who serve and heal us all. Because at the end of the day, remember, we want you all to go home at the end of your day. Thank you for watching this, and we are here to serve you.